Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. Does weed help with ADHD? Because weed, cannabis sativa, has been linked to relaxation, many people wonder if it can be helpful in managing ADHD symptoms such as trouble focusing and impulsive behavior. /r/n/r/n The research on whether cannabis can provide short-term relief of ADHD symptoms is mixed, and researchers are still trying to learn more about cannabis and ADHD. Using cannabis when you have ADHD is associated with risk, like the potential for developing substance use disorder. Using it with ADHD medications may also cause unwanted effects. /r/n/r/n Here's what you should know about the effects of cannabis on people with ADHD. /r/n/r/n Very well, Danny drank water /r/n/r/n to understand how marijuana might provide relief for ADHD symptoms. It's important to understand the two components of cannabis, which are /r/n/r/n When you smoke or consume cannabis, you take in both THC and CBD. /r/n/r/n Attention Deficit Hyperactivity Disorder, ADHD, is a common neurodevelopmental condition that affects 11% of school-aged children and an estimated 4.4% of adults. /r/n/r/n There isn't much research on using weed for ADHD because federal research on cannabis has been restricted by the drug's Schedule I status, drugs not currently accepted for medical use that have a potential for abuse. However, the research that is available gives a mixed answer to the question of whether cannabis helps with ADHD, including /r/n/r/n More research is needed to determine if weed can have benefits for adults with ADHD. However, at this time, most states with medical cannabis programs do not include ADHD as a qualifying condition for getting a license. /r/n/r/n There is not enough research to conclude whether cannabis helps people with ADHD. This includes microdosing, or taking ultra-low doses of cannabis to help manage symptoms without a high. If you're interested in microdosing to help control ADHD, talk with your healthcare provider. /r/n/r/n Although ADHD is most often diagnosed in children, cannabis should not be used by most young people. Studies have found that marijuana used during adolescence may change the structure and function of the brain, leading to long-term behavioral and psychological problems. /r/n/r/n Even states with recreational cannabis laws don't allow people under 21 years old to purchase or consume weed. Medical marijuana programs for children are extremely limited, and ADHD is not a qualifying condition. /r/n/r/n There's limited research on how cannabis interacts with ADHD medications, such as Adderall, dextroamphetamine, and Ritalin, methylphenidate. A small 2015 study of adults without ADHD found that combining Ritalin with THC caused a significant increase in heart rate compared to Ritalin alone. /r/n/r/n If you're on ADHD medications, it's important that you be upfront and honest with your healthcare provider about your marijuana use. /r/n/r/n Weed use is becoming mainstream and is legal in some places. Where it is legal, it is better regulated and safer to use. Buying marijuana products from a legal, regulated source means you will know what is in the products and how much is safe to use. You cannot know this if buying from an unregulated dealer. /r/n/r/n Your healthcare provider can help you understand the benefits and risks of using cannabis with ADHD medications. /r/n/r/n Some people believe that different strains of marijuana produce different effects. Strains are different varieties of the cannabis plant. Common marketing distinguishes between these two strains. /r/n/r/n The effects of cannabis are dictated by its levels of THC and CBD, with each having different effects on the brain and body. Pure indica strains are thought to have a higher proportion of CBD, which should increase their calming effects. However, research shows the differences between strains are not necessarily accurate, primarily because of crossbreeding. /r/n/r/n CBD oil and CBD products are advertised as providing the benefits of cannabis without the high. However, limited research has found inconsistent evidence for the benefits of CBD products. One review of studies concluded that CBD products could have short-term benefits for people with ADHD, but that long-term use was associated with ongoing problems in cognitive performance and impacts on success in school or at work. /r/n/r/n If you're considering cannabis for your ADHD, talk to your healthcare provider about trying CBD. /r/n/r/n About 30% of people who use cannabis will develop a substance use disorder. A substance use disorder occurs when substance use begins to interfere with a person's day-to-day functioning. /r/n/r/n Research shows that CBD alone, without THC, is not addictive. So, if you are concerned about developing a substance use disorder, you may want to choose a product with only CBD as opposed to both CBD and THC. /r/n/r/n Marijuana use has other long and short-term risks, including /r/n/r/n If buying from an unregulated dealer, you cannot be sure what is in the product, which may have other substances added, some of which have their own health risks. /r/n/r/n If your cannabis use is interfering with your day-to-day functioning, it's time to seek help. Remember that even in states with recreational cannabis programs, cannabis is illegal for people who are under the age of 21. /r/n/r/n There's little research on whether weed can help with ADHD. The research that exists is mixed. Some studies have found that cannabis can help with ADHD symptoms, while others conclude there is insufficient evidence to make that conclusion. /r/n/r/n In most cases, ADHD doesn't qualify for state medical marijuana programs, and cannabis should never be used to treat ADHD in people under age 21. It's best to have an open and honest conversation with your healthcare provider about using cannabis if you have ADHD. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.